some pain? Oh, ouch. Okay, but it continues. Okay, where's Tylenol? You got Tylenol. It's the reason that you take the Tylenol, it's probably not going to have pain in the toe. Because it's such a far distance for it to get to. Is that not cool? See, y'all are going to think about nerves now. And, oh, here's something else you can do, okay? You know how like you have people go, you know what, you're just getting on my last nerve. All right? Give them a nerve name. Give them a name. Find a nerve that you like, okay? And tell them, you're getting on my blank nerve, whichever one you choose. Okay? That'll make them ask questions. Okay, so we have this posterior root ganglion, whole bunch nerve cell bodies, okay? And the axons actually get to do that exit, okay? Now, as we look at my spinal nerve getting represented here, all right? And as we see it come in on both sides, what do you see it do? Split. We see it split. We see that we have a fork in the road, so to speak, and part of it goes to our anterior side, part of it to the posterior. So that tells me information going in, okay, the information that's going to, let's say information that's going to go by way of the posterior side is what we're going to see hit the ganglion. Does that make sense? Because it's on the posterior portion. Posterior root ganglion. Does that make sense? And then we see that happening because remember, we have pairs of nerves. So we have that happen on each side. On that posterior side, where does it look like that posterior portion, the part of the fork that goes to the posterior side, where does it look like it enters, where it meets?
The gray matter?
It looks like it meets the gray matter, and it does. Okay? The anterior with the white matter. So, that's going to become a little important to us because remember, we have to send information up the spinal cord and we have to get responses down the spinal cord. So, some things, this is something that can go wrong with these coverings that exist on the spinal cord. Now, with the advancement that we have in visualizing offspring, you know, the ultrasounds, all that sort of stuff, a lot of times they can pick up this abnormality. And it is one that's a little more common than you usually see, okay? But if I'm not mistaken, if it is now identified in offspring, they can actually go in now and do surgery before the baby's born. You know how they can do that now in utero, do the surgery in utero? And the reason that they want to do that, this abnormality that can happen with these meninges, if for the offspring, it becomes, it can be so serious that it can actually paralyze them, so the child is born paralyzed. So if they identify this, then they can go in and hopefully correct the problem. They have related it to folic acid, the B vitamin, and women who are lacking, and for the most part, the majority of us are lacking vitamin B, okay? Because one of the things that, depletes it is stress, okay? And, just living is kind of stressful sometimes. And so they do advise women who are planning to get pregnant, be sure to start, taking vitamin B before they get pregnant, because they have made a connection to that in this abnormality that can happen, okay, which is very, very difficult for the child being born.
Why is it so important for prenatal vitamins that you take during a pregnancy to have folic acid then if it only matters 3 months before conception?
Well, now don't forget that nowadays, like when this will be showing my age, okay, if my son were still here with me, he would be going on 33 years old, okay? So that was a long time ago for being pregnant. And back then, I didn't know nothing about that. We didn't have ultrasounds. I didn't do nothing like that, okay? And of course, you didn't know, okay, you didn't even go get the pregnancy test until probably a whole month of, missing a period, that sort of thing. Well, see, now women can, I think, test within a day of being a day late, I think. Some of those pregnancy tests they can get. So the earlier you start it, the more beneficial it is. Now, granted, if you started it before you got pregnant, that's great. But still, starting it at the point that you might actually know that you're pregnant, and now that's very early in the development stage. If you think about the process that is occurring in that fertilization, in that development, because when egg and sperm meet, fertilization occurs, and you begin to have one cell become two, two become four, four become eight. You know how you form blastocyst, gastrula, all that sort of stuff. That's when these layers are developing. So it's still beneficial. Okay? Now, granted, if you're waiting until 6 months, no. Chances are, vitamins will still be beneficial, but would it have been as beneficial? So, it's very important. Nutrition, everything. And, it becomes the situation where, I think, because back in my day, oh my goodness, I still have my coffee, still have my tea, still have my sodas, all that sort of stuff. And, like they said, cut out caffeine and all that sort of stuff now. So it's been quite a while for me. So this is something that is a more common abnormality with these connective tissue wrappings than you normally run into. But like I said, about 1 in 1,000 births. So that is rather common. So something that I've already tried to point out is about the difference between the gray matter and the white matter. And so this picture right here tried to peel back that section and the wrappings. There's a couple of things I want you to note, okay? First of all, note the very strong blood supply, okay? This is tissue that is very well vascularized, okay? Very good blood supply. This is trying to show you the differences between the innermost layer, the pia, our tough outer layer, the dura, and the arachnoid. All right, which is kind of cool. I kind of like how they show that because it is fluid, okay? So it looks like it's water to me. So we have that gray area termed central area. Gray matter is neuron cell bodies. The gray area is neuron cell bodies, Now, what does that mean? This, the gray matter, this is my area of information processing. Why? If this is my nerve, do what? I got information on both ways. So, I've got information that will move into the spinal cord. I have to get it processed, right? We have to make sense of that. Gray matter. And then the white matter, the stuff that was surrounding all around, okay, abundantly, a lot, myelinated, covered with the fatty sheath, axons, the long portion of nerve cell. Job, carry signals, either up or down. Bada bing, bada boom. I stayed at Holiday Inn last night. Is that who says bada bing, bada boom? I can't remember. But we're going to go bada bing, bada boom, and I stayed at Holiday Inn. Whew. Take a break. Be back at 10:30.